Hello and welcome to Sensei podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. So, hello and welcome to Sensei Podcast. It is my great pleasure to introduce our guest today, who is Dr. Alfonso Jurado Roman from Paz University Hospital in Madrid, Spain, a great CTO interventionalist, great friend, and author of a great article recently on the psychology of the CTO operator. So, Alfonso, thanks again for joining us.
No, thank you, Manos. It's my pleasure to share this podcast with you.
And as I always do in this podcast, I'd like to just learn a little bit about your journey. How did it start? Did you do interventional cardiology because you always wanted to? How did you get into CTO? How did it all happen for you?
I don't know. I think the path is similar than yours or other interventional cardiologists focus in these procedures. I think that the main reasons for starting this journey was to be aware of a clinical need in the hospitals I train. Patients with complex anatomies and needed a complex PCI that was not available or was not usually performed in these hospitals, and we opt to offer them the conservative treatment, and we convinced ourselves it was the best option just because there was no other option. And or even worse, we offer a suboptimal vascularization, PCI or CABG. This is the main thing. And at the same time, I observed some exceptional operators in the congresses and also locally performing procedures that I couldn't understand, with a lot of wires, a lot of devices. And I could understand the comparison of the first angio with a CTO and the last one with an open vessel, and understand the potential benefit for the patients. And combining this admiration, the clinical need, and probably this psychological profile, this personality that probably we all share of thriving on challenge, being comfortable with this complexity of the procedures, trying to be perfectionist, to improve, probably the combination makes me to start this journey.
Wonderful. And were there any people who came to help you learn this? Did you learn it by yourself? How did you actually learn the techniques to do these procedures?
Yeah, when I started, there was no specific CTO fellowship. And I think I learned the same way than the majority of us, with motivation and interest, attending congresses, reading books, your book especially, social media, internet, and obviously performing increasingly more complex procedures at the beginning with proctors that now are very good friends. And now when I started as a proctor myself, I also learn a lot. You are supposed to help other colleagues and to teach something, but always you learn a lot in this intervention. So it's a mix.
How do you prepare for these cases? Do you I look at the angiogram? How much time do you spend? How do you prepare for these complex cases?
Yeah, I'm quite obsessive with the preparation of the cases. I must admit it. I've reviewed the clinical history, and I go through the angios a lot of times, trying to figure out the plan. And every time I see the angio again, 5, 6, 7 times, I change a little bit the plan. And I used to draw it. I do a scheme in a picture of coronary arteries, remarking the main features of the clinical profile of the patient, the ejection fraction, this stuff, the antibiotic treatment, and also the anatomical features, and the plan, A, B, C, D. I try to plan everything. And afterwards, also, I try to bring to the cath lab all the material I think I'm going to use, just to save time. Sometimes the plan changes, but I bring everything there. I explain to the nurses and the fellows and the staff. And I try to prepare everything the best I can.
And do you have a CTO card where you have all your equipment, or you just bring the things that you think will be needed in the room before the
No, I
case?
have a specific place in the room for CTO devices. But even I bring the micros, the wires I think I'm going to use to the CAD lab, because if you spend 2 minutes for every material you ask for, probably half an hour. So it's better to prepare everything, in my opinion, and to have everything near.
Wonderful. Now, do you feel nervous or anxious before some of those cases? It can be often very complex. Or how do you deal with that?
Yeah, it's a very good question. And I wouldn't say anxious or nervous, but probably I am more activated before one of these cases, especially in a live case or a proctoring, than in a usual case. And I think that as we talked in the past regarding this article we wrote together, according to the law of Jerks-Dodson, probably a moderate arousal is the best to optimize your performance. If you are too calm or too anxious, probably you don't get your best version. So I think it's a good thing to be activated, but control the anxiety. And probably the more I prepare the case, the calmer I am. And for me, it's quite important to have to in order to be calm, to have a nurse involved in these CTO procedures, and also if I can, another colleague, another staff or advanced fellow to share everything, to share the thoughts, the procedure, and to share everything.
Wonderful. And then, how do you deal when things don't go well? So, as happens in these cases, there's always cases that don't work out. There are complications, failed cases. How does that affect you, and how do you bounce back from that?
Yeah, it's a difficult thing. We all have complications, and I'm not get really depressed with that, but every complication goes with me sometime, and to be honest, it influences the following cases. And another good thing is one sentence I heard you in one of your speeches in TCT, I think, or it does. There is no finish line. The end of each case is the beginning of the next one, and after every complication, I tend to review it obsessively to think what I should have done or what I can improve to the next situation. I try to comment the complication, the technical things with my colleagues and friends and mentors, and not only the technical things but also my feelings. And it is quite reassuring for me.
Wonderful. And are there any cases, good or bad, that stand out in your memory that helped you learn a lot?
A lot of cases. I don't know. I always remember my first flashing nostril CTO, my first retrograde CTO in my previous hospital, in which there were not a specific program CTO, and I did by myself. The first one is with a fellow that now is a very good friend of mine. And I don't know, I remember a case recently. I did a case of an 18-year-old kid with congenital heart disease, with all the coronaries in different places. And it has had several surgeries, several attempts, percutaneous attempts. And the parents and the kid were so worried about the situation. And it was quite I don't know. It's a remarkable case for me, and probably the technically the most difficult case I have done ever was a case I did in South Africa when I went there 1 week for proctoring. A 40-something-year-old male with also previous caveats, all the grafts off, a right CTO proximal occlusion without viability, left main diseased, 20% ejection fraction, and no left ventricle support options. So we went retrograde ipsilateral with risky tiny epicardials. So it was challenging, and we succeeded well. I remember the case very well. and obviously I have learned a lot, probably more about complications than about these cases. I remember probably the most one patient that died in the cath lab. It was a patient of 75 years old with aortic stenosis and also an LAD-CTO, a proximal one, with angina. We didn't know if the angina came from the aortic stenosis or the coronaritis, and we decided altogether to perform firstly the PCI. We crossed the occlusion antegrally easily, and during the dilatation, we have a perforation. We sealed with a papyrus, but the patient didn't tolerate it and died. So I learned that when you have this combination, probably it's better to do the TAVI and then to perform the other thing. Now I learned from every case.
And then, Alfonso, you obviously teaching this in many places, and you're proctoring. And when you proctor other people, how do you tell? Do you think this person is going to become a good operator or not? Are there some things that you use to choose the people you proctor or the people that train with you, the fellows? How can you tell?
To be honest, I don't choose the people I help; they choose me. And I try to help the best I can. The profile of the doctors we help is different. Some of them wants to do the procedure by themselves, and you only tell the options or your thoughts. And some of them wants you to do the case from the beginning. So I don't know. You observe is similar than when you see a student or a fellow. I can see from the very beginning if the motivation and the skills are good or not. Probably the most important thing for me is not the technical skills, is the motivation and the mental skills, the ability to make the correct decisions, to have common sense. I think is the most important thing, and I feel quite easily if the colleague or the student or fellow have it or not.
Do you find something specific that is difficult to teach? Some specific technique or skills? What is the hardest thing to teach to your fellows or the people you proctor?
I don't know. If you start with the retrograde, probably it's the first pitfall, the ADR, as technical skills, but probably it's a thing that we don't train, the mental thing, no? The thing when you continue with a case, when you should stop, when to change, not to be stuck in the failure mode, no, and change to another option. I think this is the most difficult part, to change, to stop, to continue, to manage the complications. I think is the most difficult part because we are not training it.
Yeah, and actually that brings us to your paper that you discuss about the mental approach and the psychology of the CTO and complex operator. So, just curious, what inspired you to write all this?
Yeah, to be honest, I always have these conversations with some of my mentors here, with José Ramón Rumoroso, with Javier Scanet, and with some colleagues. But it was after my trip to South Africa, doing 5 different places, 10 hospitals, a lot of CTOs, and trying to explain my feelings in the flight coming back to Spain. I thought, I think there is not anything written about this. I did a research and I thought, I'm beginning with this journey. Probably we need some experienced operators putting their thoughts on the paper. And I wrote you to Canvas, José Ramón, and the paper was amazing.
And then, in there you mentioned about the curve, I guess, right? How you start and then it goes down after every failure, it goes up at every success. So how do you, I guess, is the goal to minimize the amplitude of these changes? Like you don't go too far low or too far up. I mean, what is your take home? How do you approach this issue?
Yeah, it's quite difficult maintaining the balance between the humility and honest self-criticism and the self-confidence to continue with the next case after a failure of a complication is quite difficult. I think it is only learned with time. with time, speaking with more experienced operators, with friends, but it takes time.
And then, how are you able to? Let's say in a case things don't go well, right? And you're stressed out, and as you said, there is the fine balance between too much stress or too little stress. But let's say you're feeling that yourself you're getting more towards the high end of the spectrum. You're getting too stressed out because maybe the perforation, the patient is not doing well, hemodynamically, etc. What do you do in those cases? Is there any techniques we use, any mental things, any breathing? I mean, what do you do to bring yourself to the better part of the care?
I don't know, in this type of situations, I think it's of great help to have a colleague with you, and or nurses or fellows, and share everything, because sometimes it's better to stop, and sometimes just continuing 10 minutes, you solve the situation and you complete the case. So for me, the most important thing is to work as a team, and to share all your thoughts or your fears and during a case as well.
And then after the case, do you also talk to the team, the fellow, the nurses, the techs about what happened, especially for the complicated ones or the failed ones?
Yeah, of course. After a complication, all of us feels bad, and it's important to review everything and to try to figure out what was wrong, and how we are going to improve for the next time. So yeah, we talk a lot.
Okay. And then tell me a little bit about your personal approach to radiation and the risks, not for the patient, but for the operator. Because, sometimes we forget about ourselves, right? We are all focused, okay, we get the patient, and then you've done the 5-hour case. There's 4 gray for the patient, and you got a lot of radiation as well. So what do you do to protect yourself?
Yeah, I'm quite obsessive with all these things. So I try to improve all the settings, to use all the protection measurements, try to teach these measurements to the fellows and the resident. Indeed, in the past, in my previous hospitals, we perform a local protocol to reduce radiation, and we convince the people that using all the conventional measurements, you reduce the radiation exponentially. So we are quite concerned about these issues, and we try to optimize everything to reduce it.
Do you use the Rampart or any of the other systems?
Yeah, we don't have it. I'm fighting to have it in my lab, but we don't have it.
Okay. And then how about the hours standing and everything? Do you get issues with back pain and all these things that some people get, or you're able to handle this fairly
Yeah,
okay?
I've had back pain a lot of time. I'm quite tall, as you. I used to play basketball in the past, and a lot of hours standing with the lead and also the computer. I had a very big problem 2 summers ago. I thought I have to do something else, because I do a lot of sports, but I have back pain. I started doing yoga because my wife told me about that. I like it, but I confess that I need something more energetic. I need more endorphins, sweating, competitive sports. But nowadays, I have changed my the way I exercise, and I do every day. I go to the gym or I work out at home, focusing on my back, the core, and strength, and I have improved a lot my back pain.
Okay, perfect. So you do take take it seriously, and you try to keep in good shape throughout the day. And then how do you find the time for all this?
Not sleeping so much because I have 2 small kids, and they are my priority. And during the afternoon, they are the startings of everything. So I try to wake up very early and try to go to the gym before going to the hospital. I go to the hospital by bike, and try to make everything possible together. But it's quite difficult sometimes.
So how far is the hospital from your?
No, about 15 minutes or 20 by bicycle. I go by bicycle or by the underground. Yeah.
Perfect. And then, how many hours do you sleep?
I try to go to bed at the same time I of my kids. I don't know, 9 p.m., half past 9, and then probably 7 hours, 6.5. Yeah.
Okay. And then, everyone talks about the stress and then the call and how it throws you off when you're on call one night. Did it ever happen to you to have to do CTOs or complex cases after you've been up at night for emergencies, STEMIs, all these cases that come up?
Yeah,
And how do you deal with that?
several times. I try to schedule all the CTOs not the day after an on call, but sometimes it's difficult because we were not so many staff in the past, and it's difficult. I try to do my best. When you are activated, probably you perform the CTO, but afterwards you go down and you go to bed as soon as possible. But yeah, sometimes it is needed.
Wonderful. And then, in terms of other things personally, what do you have any favorite movie or any favorite book that you like?
It's a difficult question. I have changed my favorite movie and book several times. I remember I love Braveheart during years. I like also classics as Godfather or I don't know, and I love thrillers as well. And it's the same in books. I am reading a lot, different kind of books, but I think the books that really distract me and makes me disconnect are thrillers, crime books. I love some Spanish writers, Juan Gómez Jurado and Santiago Díaz. There are some very good books, and I also have one of the nurses that work with me. Is my book dealer, no? So she passed me several ebooks, and I read a lot now.
And how do you find the time, with all the cases and the family and the proctoring? How do you find the time to read? Did you do in travel, or how do you
during
fit
travels,
everything in?
I used to read a lot during vacations, but now I read every day before going to bed. Even if I have a primary PCI late night, I read 5 minutes or 10, and I disconnect. And every day I try to read.
Perfect. Well, that's certainly one way to keep you up to speed and keep you also, more fresh. As you say, more maybe the mental skills can improve from that part as well. Do you do any other things that keep you in good shape? So exercise, you try to read, you have the time with family. What is the thing that gives you the most energy, you think, to function at the high level during the cases and afterwards?
I don't know. I think it's the healthy lifestyle. Obviously, talking about mental thing, probably the family is the energy of everything, the engine of everything. And I think that exercising physically is quite important. And I don't know, reading, I also listen to podcasts, history, philosophy, medical podcasts as well, sports, everything, a healthy lifestyle, I think.
Perfect. And then what excites you the most right now?
What, sorry?
What is most exciting to you right now from the things that you're doing?
I don't know. My family is the most important thing, and laborally speaking, probably trying to improve always as an operator, as a cardiologist. I need to feel that I'm improving and evolving. I love teaching as well. It's one of my main vocations, and I love being near to the youngest, to the residents, the fellows. And I love also research. I have more ideas and time to develop trials. I throw the ideas to the fellows and the residents, and I love it as well.
Wonderful. And what do you see in the CTO area? What do you see as the next big thing? Are there some things in the pipeline that excite you? You think we've reached a plateau in terms of what we're doing or what we're doing in the future? Well, what do you think?
I don't know. I think there are some new devices, but probably the big thing there was an attempt of the robotic thing in regarding CTO. I don't know if it's the scenario for the robots, but now artificial intelligence is pushing very hard in all the medical things. I don't know if it has a role in our business as well, probably.
Wonderful. And then, what are you most proud of, personally and professionally?
Personally, the question is easy. My kids, my family, and liberally speaking, beyond the awards and the titles and this stuff, probably the most rewarding thing is the feeling the respect and the affection of the people who have worked with me, the colleagues, fellows, residents, and also the gratitude of patients. Probably, I think, is the most important thing for us, for doctors.
Awesome. And what is your plan for the future? What do you plan to be doing in the next 5-10 years or more?
I don't know. The future is uncertain. If I am healthy, I would like to continue performing this kind of complex procedures many more years, and continue teaching. I would like to start in the university as well. In Spain, it's quite difficult to get into the public university, but it is one of my ambitions. And also performing some research that not only for the sake of publication, is some research that makes a difference or add something else to our job.
And in the research, are there any topics you're working on right now that you find exciting for down the line?
Yeah, we are working a lot in plaque modification techniques. We are finishing one randomized trial with different techniques, and we are planning the next one. And these are my main items now, plaque modification techniques.
Perfect. And I guess we'll see that the CTO patients and the complex patients, the CTO are complex and the complex are like CTO. So there's a lot of overlap between those two areas and on the things that we're doing. So Alfonso, what would be your advice if someone comes to you today and says, "Look, I want to learn to become a complex CTO operator"? What would be your advice? How can they maximize the chance to become great operators?
Yeah, I think the main thing is to have the motivation. If you have the motivation, probably you have 80% of the thing, no? Because you have to be involved in congresses. You have to be near people you admire or you can learn with. I don't know if you can apply for a specific fellowship. It would be the best option for me. If not, it's important to be near specific operators, and not as a first operator. I was a fellow, and I understand that all the fellows want to perform their own angioplasties, put in a stand by themselves, but probably you learn more being the second operator of these kind of procedures and it takes time. So train, not only CTO, complex PCI, you need to train to be motivated, and that's the thing.
Perfect. I love the thing about motivation. So how do you motivate someone? Or is it something you either have or you don't?
I don't know. I think there are both things. No, there are people who is motivated from the beginning, and probably you need to motivate them. They need to feel some rewards. No, if they are learning something, they are improving, they publish something, they attend to a congress, they have positive reinforcement. I don't know. They need. It's a bi-directional business, no? But probably the initial motivation is quite important.
Wonderful. And you're right. I mean, having people engaged and being connected with other people, through meetings, as you say, or presentations, or working with other people, I mean, that's a huge amount of motivation. And obviously, you need the motivation, as you say in your paper, to be able to finish this case, because sometimes they can be problematic. So to finish it up, how do you balance the humility with the motivation and the need to feel good about yourself to do these cases?
It's quite a difficult question because probably the cardiologists and even more the interventional cardiologists had a very big ego and we always want to perform the case and to be successful. But I think that the most important thing is to put the patient in the middle of all our decisions, in the center of the decisions. If you do that, you can balance the humility when you fail, also when you succeed, because you are not the best operator when you succeed, not the worst when you fail, and to balance it to offer the best of yourself to the patient. If you try to be a good person, a good doctor, and to put the patient in the middle of everything, probably you are in the good path.
Absolutely. I think you're right. Sometimes, we forget that it's all about the patient, and that's where it starts, and everything we do, that's the end of the day. So if the patient gets as good as possible outcome, and not always, but most of the time, that's what counts the most. So Alfonso, thank you so much. That was a wonderful, meeting you online and discussing more of this with you. Thanks for everything you have done. And again, very excited to work with you. Good luck on your future endeavors in teaching and research as well.
Thank you. It was my pleasure for sure. Thank you, Manos.
Thank you for listening to the Sensei podcast.